using it as a way of getting warm humidification to a patient with a trach. And then after you all did your evaluation with the Venturi apparatus, I brought to your attention in class the other day that, you know, unless you have something like low FiO2 you need lower than about 28%, you could just go straight from the nebulizer. So that probably was not a happy occurrence for you to find out I cheated on you that time. That's why all your evaluations are with 24%, so that you could learn to put it in. This is the large volume nebulizer. I'm going to open it up for the first time with our new patient. We're going to say our patient orders state he needs 40% oxygen. So if you know the patient, or if the doctor's nice enough to put into a trach collar, you know that we have to have the patient with heated humidity because he has a trach, and you know to bring the right equipment. So we're going to assume we know that. I'm going to gather the equipment right here so you guys can see it, but you don't have to imagine me being in the patient's room yet. I just want to show you the stuff we need. First thing's a large volume nebulizer. Then, as you know, we're going to need a couple pieces of blue corrugated tubing. And I would ask you, when you're taking it in the patient's room, if it's the kind that you cut your own like this. Hey, where'd that water come from? Somebody spilled some. That's why you need these bags. See, if you lay it down on the table, it stays dry on the inside of the bag. So anyway, put it in a setup bag if you're carrying it loose like this. You don't want to put it directly down on the patient's table. And then I'm going to get a flow meter. Not that one, not that one. And a drainage bag. And I'm going to need a trach collar. The trach collar comes overwrapped like this, so it's in plastic, so you can set it down without getting it exposed to something bacteria laden on the patient's table. Gather up all these things before I go to the patient's room, and then you want to go through the same series of steps. We're going to look at the patient's chart, make sure that the order and the equipment and everything that you have is appropriate based on the clinical practice guidelines. For example, clinical practice guidelines tell me if the patient has a tracheostomy tube, I have to use a tracheostomy collar or a T-piece. They tell me if he's breathing through a hole in his neck, that means he has a bypassed upper airway, so we need to provide heat and humidity at body temperature, BTPS. So those are the kind of things that you get guided on with the clinical practice guidelines. Check my order, check my equipment to make sure it was appropriate for the patient, order's appropriate. I'm going to wash my hands, and we're going to go into the patient's room, like we always do, knock, knock, knock. I have a feeling this patient's not going to sing. So, Mr. Trachea, hi, my name's Jan Johnson. I'm here to set up some oxygen for you. Mr. Trachea? Not going to answer, but I still need to check his ID, don't I, to make sure I have the right patient. It's surprising how patients will get up out of their own bed and get somebody else's bed, and then you ask them, are you Mr. Smith? And they say, yeah. You're like, wait a minute, you're not Mr. Smith. You're in the wrong room. You've gotten lost. Okay. Mr. Trachea, I'm going to put this pulse oximetry device on you just to check the oxygen level in your blood. Okay. We'll pretend like he has a finger, and we'll let all this take care of itself for the time being. Meanwhile, I'm going to hook all this stuff up. Oops. Immediately forgot something. That's one demerit for me. The heat for my heated humidity. I'm going to show you how these look when they come right out of the package, because we reuse stuff a lot in the lab. So I'll show you what it looks like. Comes in a plastic overwrap. It's got a bottle of sterile water, and it's got the nebulizer device. And so when you get it fresh from the package, it's got a little seal around it that lets you know it's still sterile and not been opened by anybody. And when you open these water bottles, it's a good idea to put a date on them. After 24 hours, if it's still sitting in the patient's room and it's open, you're supposed to throw it away. So that comes into play a lot more often when we're doing trach care and tracheostomy suctioning and stuff, but just want to bring that to your attention, put the date on there. And also, if you're going to reuse this bottle like you would in suctioning, you don't want to put it down this way because it might pick up some contamination from the table. So set up the lid part up. Don't touch the inside if you can avoid it, because that would introduce bacteria into the gas flow that the patient's going to get. This thing is all sterile till we mess it up too. So you peel this back. And you want to hold it by the outside, not by anything that's going to come in contact with the patient's gas or water. The little capillary tube is quite, jiggly. And if you're nervous and your preceptor's watching you, it might be a hard task to get this in the bottle, but you want to get right in the center of the bottle, not touch it to the outside. And screw that into place. And I said 40% oxygen, so you just set it with this little blue dial, 40%. There's a little notch there that you line up the little white line with, 40%. And this is going to be heated, so I want to remember to put my heater on it before I attach the flow meter. And I'm just going to attach it here because be really careful when you put on this white nut onto the flow meter because they get cross-threaded real easily. The plastic's pretty soft. And since we reuse them, if you're having any problems at all where you're not seeing a mist or something, it's probably this thing that we've reused one too many times. So if that's the case, get another one. You want to make sure anytime you're using the nebulizer that you can see a flow of mist coming out of it. Otherwise, it's not doing its job. So make sure you see the mist. And we're going to plug that right in here. Now it's 40%. What kind of liter flow do you think I should choose for Mr. Trachea? My minimum that I really want for the patient is at least 40 liters per minute, or more. So, what do you suggest? Remember the ratio for 40%? 3 to 1, so that's 4 parts, right? I want at least 40 liters. 40 liters divided by 4 parts is 10. I'm going to set it at 10 or 11 or 12, something like that. I'm going to go 11. Okay, and do we see a mist? I do. You really have to get over here to see it. So if you don't see the mist, like I said, you have to make it mist. If it's brand new out of the package, it should mist when you set it up. So make sure you put it together properly. If it's one of our old ones that we're using for lab purposes, be suspicious of that white nut. Okay, now I'm going to hook up the rest of the tubing and equipment for the patient. And remember, we get everything flowing before I attach it to the patient's earway. So you've seen this guy before. This is Mr. Drainage Bag. Nothing there. I don't think you guys have seen all the little gadgets we have though for hooking this up to the bed. It comes with a hard hook or a soft hook. We're getting new oxygen. That's a good thing. Okay. So I'm going to hook this under the bed. And then, last but not least, I'm going to put the trach collar on the patient. Can you see the mist there? Mm-hmm. That's a lot easier there, isn't it? It works better behind something dark, too, so if you can put it in front of somebody's Navy blue uniform, you can see it real well. But against light walls and light bedding, it's hard to see. If you haven't already done so at this point, when you get the trach collar, you're going to want to put some gloves on because you're going to have to slide your hand under Mr. Trachea's neck, and sometimes they have lots of secretions and they get damp behind their neck and so forth. So make sure you have something on. Mr. Trachea, hooking up your oxygen. Trying to. You get it on there, you know, you might be able to get a finger or two under the trach string. You don't want it so tight that it's cutting off the circulation of blood to his brain. So get it on there firmly, but not overly tight. At this point in time, by now I've looked to see what his SpO2 was on room air when building all this stuff. And then it's going to take him 5 minutes or so for his body to acclimate and get equalized with the 40% oxygen I'm giving him. So this would be a great time for me to get out my stethoscope, to do my assessment, one way to see how he's going to do on his oxygen. So at this point you can take his pulse, and make sure it agrees with pulse oximeter. You can take his respiratory rate. Since he's not aware of us, we can just flat out count it. Did Tammy show you how you can just keep holding onto the wrist and kind of fake them out, count the respiratory rate? Okay, so now anytime you go to the doctor or visit your doctor and they're holding your hand, you're going to be self-conscious about how you're breathing. Never be able to breathe because you know the trick now. Okay, so I've done his heart rate, respiratory rate. I'm going to listen to breath sounds. Quite often we have trach patients while we're doing their oxygen rounds. We have to suction them, and we'll get to that towards the end of the semester, but that would be another thing that you could busy yourself with to make sure the patient's just in tip-top condition when you leave. After doing all his vital signs and looking at his perfusion, listening to his breath sounds, you can take a look at this. Well, let's say it's reading 85%. What should I do? If I increase the flow, what will that do to the amount of oxygen he's actually breathing into this one? Pardon me? Yeah, the FiO2 stays the same until I turn this little gadget. So let's say I decide to turn it to 50% because he's not doing well. He's only 85% on 40. I turn him to 50%. Anybody remember the ratio for 50%? 1.7 to 1. Okay. We're going to say it's 2 to 1 because it's easier for me to do in my head. Okay. 2 to 1. 3 total parts. And I need to get him 40 liters. It would be like 14 liters a minute, wouldn't it? 13 would be 39. 3 times 13 is 39. So I'm trying to get to 13 or 14, and I have turned this thing all the way up. It's not going anywhere. The reason it's not going anywhere is because we've got that very small jet that the gas has to pass through. And that jet can only accept so much flow at a time. At this point, we've maxed it out. All I can get on here is, I'll be generous and say 12 liters per minute. So at 12 liters per minute times 3 parts, 2 oxygen, or 2 air and 1 oxygen, 3 times 12 is 36. I'm not happy with that. So I got to do something to supplement the flow to this patient. And so let's talk about doing that. Before I do that though, I want to show you this. I'm going to put on a mask. I'll put on a baby mask because it's easier to get right. Okay, I'm going to put on a mask and I can see the flow. Can you guys see flow? Okay. What I want to do is make sure that the flow always is high enough so that it exceeds my inspiratory flow, and there's always a little bit of mist coming out these ports, even when I'm inhaling. So at low flow rates like this, because we're not getting our above 40, can you see the mist coming out? Okay. Watch what happens when I inhale. Yeah. Did you see it disappear entirely? That's what we want to avoid. We don't want the equipment not to give me flow faster than I'm breathing it in. And the only way we could do it with the venting is calculate it because you couldn't see anything. But with this, when it's on him, of course now the patient isn't actually breathing, but if you think about the patient breathing this mist in, we should be able to see mist even during inspiration. So during expiration, we'll see lots of mist. But during inspiration, if it all disappears and we can see it disappear, that means the flow rate's not high enough. So we need to do something about it. Okay, we tried throwing the flow meter up, that's not working. So here's another situation you can use to take care of it. I'm going to get a new nebulizer. Of course, it would be in the paper and all that, and I'd have to build it. Put it on 50%. And get another heater. Get lots of nice warm gas going to the patient. And another kilometer. And I'm going to set this at 50%. So let's say I've got 12 liters per minute there. If it's in training, 2 additional liters for every liter of oxygen. We figured out 12 times 3 parts is 36. And that wasn't high enough for me. So I'm putting on this adapter here just to show you that you can, even if you only have 1 oxygen outlet, you could still do this. You just get a Y and hook it up. Okay, so this is going to be my patient's second nebulizer. So I could, if I wanted to, put this one in here as well. And this one's maxed out on 50%. The flow is as high as it will go. But if each one is giving the patient 36 liters per minute, that means I now increased his total flow to 72, and that should be really good. Of course, it's not finished yet, but when I get it finished, it'll be 72. I don't know how this got so wet. So in order to get these 2 things together, I need to get a couple of little pieces of this corded tubing. Yesterday I cut one that was 2 and one that was 3. Today I'm going to even it out a little bit. When you guys go to cut your tubing, there's like these ridges that get smooth, and then right in the center, there's a little ridge about 1/4 of an inch wide. You want to go right in the center when you cut this, because if you don't, it'll be hard to build on it. It won't fit correctly. For me to say. Okay, so I'm just going to take an ordinary T-piece. This is the same kind you guys have used in some of your other fun activities. And we're going to put one end of this to each nebulizer, and we're going to put the patient's tubing up here. That's really all there is to it. Okay, so now we've boosted his flow, boosted the amount of gas and humidity that's going by. Can you see that better now? There's a lot more going through there. Alright, so now he's on 50%. We've bulked up his flow. Let's say, so we're working with, so we're working with him. We check his, we need to check that the high flow of gas is actually 50% as it reaches the patient. So I need to stick in an analyzer. Can you guys tell me where the analyzer should go? Closer to the patient, yeah. So you put it in right here, or you might attach another piece of blue tubing so it's not right up against his skin, but right there would be a good place to attach that. What if the hospital you're working in requires you to monitor the exact temperature of the gas going to the patient? Where would you put the thermometer? Same place, up close to the patient. Okay, if you wanted to, you could cut it here so it's a little more flexible by his neck. In fact, I'll do that. Why not? So you cut the tubing. And I need an adapter. I bet I don't have that here. Back to plan B. Okay. But you get the idea. I could separate it a little bit from if I wanted to. And this adapter, this humidifier, or temperature monitor, thermometer, comes with 2 adapters when you get it out of the package brand new. So I wouldn't have been in the jam that I was right here without the adapter. Okay, one other way to boost his flow that I wanted to show you. And that's this thing. Excuse me. This is called the Misty Ox. Basically use the same kind of water bottle for this setup. And to the water bottle, we're going to attach this heater. And one of the things I don't like about this style of heater is that the gas flow that goes to the patient actually comes in contact with this reusable piece of equipment. So there's a risk, if I don't clean it well between patients, that I could introduce some bacteria into the patient's oxygen, heated oxygen. So that's one thing I don't like about it. This Misty Ox thing, just attaches like so, and you can do one of 2 things. You can put it on one of these regular flow meters, turn it up to max. Did you ever notice it says flush on the top of some of them? Turn it up as high as it will go. And the nebulizer itself has a restriction that will prevent any more than 40 liters per minute coming in. So you can use a regular flow meter, or you can, if you have one available, you can get a special flow meter that has higher flow settings on it. This one goes to 75 liters per minute. So I can run this at 40 liters when I hook it up. Most of the time you can't find these. So you can just use a regular one, just turn the flow as high as it will go. And then there's an oxygen diluter on here, just like on our other one, that allows us to set it anywhere between 60 and 100 or 96% oxygen. Okay, so if I wanted to boost him up to 60% this time, because he wasn't doing well on 50, I could set this at 40 liters per minute. And then if you look at this little adapter, it will tell you what your total flow is. But you guys are so smart, you'll be able to figure it out. What's the ratio for 60%? 1 to 1. So if I've got 40 liters of oxygen going through, how much room air is it going to suck up? 40 more. So the total flow is 80. And when you get patients that are on high amounts of oxygen like that, you want plenty of flow because you want to make sure their inspiratory flow rate's being exceeded. They're in a situation where they need every bit of it. So we just plug this in. Oops, that's not going to work. So let me take this out so you can see it. Okay, plug this on and turn it up to 40 liters per minute. And the same tubing setup that we used before, we can use on that. And we should be getting tons and tons of oxygen and flow. Alright, so those are 2 options that next week when you do your evaluation, you're going to need to potentially use for your patient. So if the patient's on something less than 50%, you can just use 1 flow meter, 1 nebulizer, and you're good to go. When you get to 50, you either have to double the flow or use one of these high flow systems to get something to accelerate the flow of the patient. For 50%, it works good with 2 flow meters. For above 60 and above, you can grab this thing. Or you could also, for 60%, you could use 2 flow meters as well. It's just the higher and higher you go, the harder it is to get that. And so you're probably wondering, well, what if I use 2 flow meters and it's still not enough? That's a point where we start thinking more aggressive oxygenation, like CPAP or BiPAP, or even intubation, or, excuse me, he's already trained, or even put the man on a ventilator. We could put him directly on a ventilator through his trach. But those would be